Howland Implant Center, we call dentures a means to an end, or we use them to get patients to dental implants. With the advancements at this office and advancements in dental implants, dentures are really kind of becoming a thing of the past. They're usually used as a device to set teeth, to get patients an aesthetic value prior to surgery, or get them through a healing period. Past that, we normally take patients into implants. And there's different types of dentures. You know, we have dentures that pop in and out. We have dentures that are implant retained. Even the dentures implant retained now, with the advancements in 3D printing, we don't really recommend them at all, to be frank. We've actually transitioned a lot of our patients away from removable dentures and implant retained dentures into hybrids. What we normally see when patients come in and when we're talking about it in the consult is, if it's a implant retained denture, a lot of the dislikes that we hear is that it still rubs, still comes out. Gaskets have to be changed every once in a while. And normally when you do find out the gaskets need to be changed, it's never at home, it's always at dinner or something like that. So when we do have that consult, we talk about it, what we see is that rubbing and that pushing that's on the tissue that patients experience actually causes bone resorption. And so what that does when I get my hands on it is it causes complications. You know, there's areas where the implants are that retain the denture that looks great, but usually in the extension parts, the part that's rubbing, we do tend to see some bone loss. And so what that does is it complicates kind of what we can do, and it compromises the outcome a little bit when we get to it. So we recommend when patients come in for dentures, if they are looking into dental implants, to move forward as fast as possible, only because the longer they wait, the less bone that we have to use. What that means for me as a surgeon and for the prosthetic is that the implants get shorter and then the prosthetic gets longer. And so when you get something like that, that tends to get a little more compromised. I like to get my hands on the patients that are in dentures when they're in there for about a year or two and things are nice and healed up, and that gives me a good amount of bone to work with.